My name is Brenda K. Senne, and I'm 58 years old. I'm from a small town in Iowa called Thompson, and it's in Winnebago County, and it's right along the Minnesota border. So I'm about an hour away from the Clarion facility. And I had a total right knee replacement on November 30th, 2016. So I'm 8 weeks post-op. Basically through word of mouth, I had a relative that had a partial knee replacement, and then in the facility that work in Garner at IMT, there was several patients of Dr. Lee that highly recommended him. Plus I did a lot of research online. I was very concerned about infection rates, and this hospital had the lowest infection rate of all of them that I had considered going to. I had lack of movement. I was less than 75% flexion. I could not walk more than a block without having to stop and rest. With being bone on bone and the bone spurs, it was just pain, constant. It was always there. It was there when you slept. It was there when you were, holding your grandbaby. I mean, you constantly had that pain. I'm still so new. I'm only 8 weeks out. I'm still in physical therapy, but I'm so excited because I was able to actually cycle all the way around Monday in therapy on a bike, and I haven't been able to do that for years. So I'm thinking that's probably the biggest thing that's happened to me in my life for a long time, is being able to get my legs to actually ride a bike. A lot of people take that for granted, but when you can't and you're not able to, it's hard because it's a part of your lifestyle that you really don't want to give up, but you're forced to. Oh man, when I was here in the hospital, they made my stay absolutely wonderful. I did not want to leave. I begged on my last day, just let me stay here one more day. I consider them part of my family. Even though I only spent 2 days with them, they took care of me. They made me feel comfortable. They provided me with the inspiration that I needed. I'm a big person. I'm 5'8" and a half. And when they told me 2 hours after surgery that it was time to get up and walk, I just looked at them and said, "Are you sure this knee can handle my body size?" And they gave me all the confidence in the world. And once they got me out of bed, we walked, and I walked, and I walked, which was just amazing. Without pain, no pain, first time in about 20 years. If you're apprehensive about getting something fixed, then it's not bad yet. I mean, you get to the point where you can't, your whole life has changed because of something that you have no control over. Case in point, I became a new grandma, and, okay, I'm gonna cry. My son told me that I couldn't hold him unless I was sitting down because they were afraid I was gonna fall. Trip and fall. Because I have done that. I had to have surgery on my arm because I tripped and broke my wrist. But I knew that I needed to have a new knee. I had to find somebody new to do it. I had my third surgery on my knee. I was only able to regain a flexion of probably 90%. And so from that point on, and that was 20 years ago, was my last knee surgery. So from that point on, I could feel it slowly getting worse and worse. Things that I enjoyed doing, like golfing and that sort of stuff, I had given up doing because it became so difficult to do. But when I fell and broke my arm, it was kind of like I blamed it on the icy sidewalk, that sort of thing. And then I started thinking, no, it was because I wasn't picking my leg up because I don't have that mobility to do that anymore. And then in the last year and a half, it had gotten worse. I mean, to the point where I was pretty much walking straight-legged and walking with my hip. I wasn't using any of my knee joint whatsoever because there wasn't anything there to use. And then with the conversation with my son about the safety of me and the new baby, then I knew that things really must be bad when my children are telling me, you need to have this done. You need to get this fixed now. My daughter kept saying, you can't be miserable like this anymore, Mom. We've got too much we want to do with you, and sitting in a chair is not one of them, which is what I had to do. Most orthopedic surgeons that I saw before I saw Dr. Kincaid told me that I was too young because the life of a knee replacement is guesstimated at about 20 years. And at 55 and 56, they kept telling me that I was going to outlive the life of my knee replacement. And like I told a lot of orthopedic surgeons that I saw, is if you make me wait to that magical number, which no one could really give me, be it 62 or 65 or however old, I will be in a wheelchair. I won't be walking anymore. And I'd rather take the chance of having a new knee and enjoying a lifestyle that someone my age does and worry about the wheelchair in the later life of my knee, which to me makes no sense because I'd rather be in a wheelchair at 78 than at 58 by far. And the way that the medical community and all of the changes that we've seen in the last 20 years, who knows, maybe they'll have a more bionic way for me to survive in 20 more years, who knows. But yeah, I'll take the wheelchair 20 years from now instead of now. Iowa Specialty Hospital and Orthopedic Specialists, I would recommend to anybody. Actually, I already have. I've referred 4 of my friends, not all knee patients, but shoulders, hips, and knees, to visit these people, talk to them. They're kind, they're informative, they are intelligent, they know their field, and I've not found anybody better in any of the research that I've done.